Hi everybody. We're at the end of a day, and as you can see, it's quite quiet in there. Almost everybody's gone. The only people left at the clinic here are myself and Janet. So I thought it'd be a good opportunity to give everybody a nice tour of the clinic like I've been promising for the last couple of months since we've been moved in since late October. So come on and follow me. So here we have a reception area, and actually my favorite area because of the particular design. So when I started building this clinic, I had a real vision of what I wanted, and everything from the color palette, the design, the sights, the sounds, the music, even the smell, I had a particular vision. And I worked with a couple of really talented designers. Their names are Max and Richard of Les Ensembliers, and they were able to really take this vision and make it a reality for me. So now that the clinic is built, I couldn't be more happy to have and be in this space every day. And as you can see, really kind of modern. The look and feel was not supposed to be of a medical clinic. What I wanted was more kind of boutique hotel, Four Seasons feel. And as I said, it was about music and a really comfortable area where patients can feel like they're not at a doctor's office and that they don't mind spending a little time here because it's a pleasant atmosphere. That combined with the great staff I have at the reception really make it quite an experience when you're here, and that's the feedback I'm getting from patients. So I even went and took an extra step, and we made a coffee bar here, which since it's COVID, we haven't really been using very much, but once restrictions are loosened and things become safe, we'll be glad to serve every patient that comes in a nice cappuccino or an espresso. So this is kind of the transition area between the waiting area and the clinical area. And if you follow me, I'll show you. Again, while it's pretty quiet right now, this area here, this hallway gets pretty rock and roll because these are all the rooms. We have 8 treatment rooms, 1 conference room, and 2 doctor's offices where we do all our clinical treatments. So this is where I see my patients in consultation. This is where I see my pre-op, post-op patients, many patients who've had surgery, but also the rooms I use to do my Botox and fillers, and the rooms that we use for a laser technician, Isa, to do all her laser treatments as well. And if you follow me, you can see many rooms that have a very similar configuration, and every room here is equipped to do lasers, to do fillers, Botox, and for me to see my patients pre-op and post-op, of course. My office is right here. Maybe a bit of a mess because this is the end of the day, but you can see in my office I have the ability to do injections, Botox fillers here, as well as see my patients during a consultation or even post-operative appointments. The plants back there are courtesy of my head nurse, Tanya, who's been nice enough to kind of water them every day because, as she knows, I am terrible at keeping plants alive. So this is the room where I do all of my rhinoplasty, meaning nose job, and breast augmentation consultations. And the reason being is this 3D camera here. It's called a Vectra. I've had it for almost 10 years now. And the reason it's so useful is because what we do is we take a 3D picture of the patient's face or body, in the case of breast augmentation, and we can use 3D imaging. And essentially what we're showing is the patient an approximation of what the result can be. So whether they want to remove a little bump on their nose or just refine their nose, we can show them, again, an approximation of what that could look like. And in the case of breasts, it's very useful in choosing breast implant size. We can click on different implant sizes, and the patients get to see what it looks like on their own body. And it really makes that implant choice much easier for them. So now we're in one of the laser treatment rooms. We have 2 dedicated laser treatment rooms for a laser specialist, Isa. And the 2 lasers that we have here, one is a Cyton, and the Cyton is a great platform because it can do so much. It does anything from removing brown spots to little spider veins, to actually resurfacing and really treating deep lines and wrinkles of the face, and even skin tightening. So it's one of these platforms that really does a lot. This device here is called a V-Beam Perfecta, and it really is great for scar treatments. So patients who've had surgery, starting at about 2-3 months after, we often treat them, and it really helps for that scar to kind of reorganize and become flatter and smoother and more pale quite quickly. It's also used for vascular lesions, and vascular lesions are veins, little arteries that might be visible through the skin, or any sort of red lesions that people want to remove. So one of the great things about this laser is its really deep resurfacing capability. So in patients who have really deep fine lines, and particularly around the mouth, those smoker's lines or the chin, we can use it to aggressively really resurface and decrease the appearance of those lines. There is some downtime involved in that because it is quite a deep treatment, but we often do it at the same time as a surgical treatment like a facelift. So many patients of mine who go on to have facelifts, while we're doing the procedure towards the end, we'll do this laser in the area around the mouth and chin. That way the patient doesn't have to recover separately from this laser treatment. They do the recovery at the same time as the facelift recovery. So this is a second laser treatment room, and you can see here, this is a radiofrequency microneedling device. And over the last couple of years, radiofrequency microneedling has become insanely popular because it is just so effective with less downtime than a lot of the other lasers. And essentially what it is, it's a handpiece that has 12 little gold needles that are 3 to 4 millimeters deep, and those needles penetrate the skin and stimulate collagen. So the result is tighter skin, a decrease in fine lines, so it can help fine wrinkles. It also helps with having pores that are smaller, so it shrinks pores, and helps with the texture and overall hydration of the skin. Typically, patients will have 2 to 3 treatments to get the result that they want, but as I said, there's very little downtime, and oftentimes the patients just feel like they have a light sunburn. This is the GentleMax Pro, and the GentleMax Pro is one of the most successful lasers for hair removal. The reason why it's so successful is because it can treat people with different skin tones. So one of the limitations with hair removal in the past was that people who had darker skin couldn't have hair removal because the laser couldn't distinguish between the dark hair follicle and their dark skin. But with this laser, the laser technology allows us to remove hair on people of any skin tone. So again, really useful. Like any hair removal device, it does take several treatments, typically 5 to 7 treatments to really permanently eliminate that hair. So one of the things I did at this new clinic of mine was I wanted to have a dedicated pre-op room for the patients who were just about to go into surgery. And what I wanted was kind of a comfortable, warm area. Patients are typically nervous right before surgery, so I wanted a place that was inviting. And as you can see, the color palette is nice for the patients. They also get a nice warm blanket. There's music, and we just try and keep the patients as comfortable as possible at this particular point right before their treatments. This is the area where the patients will get the IV. This is where they get their first vital signs, so we check their blood pressure, their pulse ox, to make sure everything's normal before surgery. Yeah. So one of my favorite rooms in the entire clinic is the conference room here. And the reason I built the conference room was because we have quite a large staff now, so this is where we hold all our meetings. We usually have monthly meetings for the reception staff, the people on the clinic side, and monthly meetings as well with the operating room staff. And it's just a nice, comfortable environment. I love the windows. The other thing that we do here is some teaching. I've always been involved in teaching when I was on staff at McGill. Now I'm on staff at the Université de Montréal, so I teach residents and medical students. Having an area like this with the ability to do injections live in front of people is really helpful for education. So through this door are the operating rooms. So anybody who's not on the operating room staff technically is not allowed back here. To cross this threshold on an operating room day, you have to be fully in scrubs, you have to have a hat on, you have to have a mask. So typically you wouldn't be allowed and you wouldn't get to this area on an operative day, but because nobody's here, follow me. So in this area I have 2 operating rooms. I will show you one of them. Both are very similar. And the reason I built 2 operating rooms was because, there is a possibility that someday that other surgeons may operate here. But really, for my purposes, because I like to have a good amount of privacy for patients, and when you have 2 rooms, it allows you to keep things a little bit more separate. And it's actually worked out well because now that we have COVID, there's a long period of time before the next patient comes into that same operating room, so we can really disinfect it quite well, and it just makes things safer. So this is one of the operating rooms. And as you can see, nice windows, nice view. I don't really get to appreciate the view so much while I'm operating, but certainly it helps to have that natural light and make it a really pleasant working environment. And the staff definitely like having a nice area with a lot of light. And it's a pretty large operating room, so it gives everybody the space and the comfort that they need. So this is the last part of the tour. This is a recovery room, and this is where patients go after they've had their surgery to recover from the anesthesia. The way we've put it together is it gives every patient a great amount of privacy. Every patient has their own pod. There's space for 4 patients, plus another couple of spots with chairs, recliners, so that every patient can recover, and we can really take our time and give the patients the attention that they need. We have one dedicated recovery room nurse who's fabulous. She really takes great care of the patients and makes sure that they're comfortable before they go home. And before they go home, they have to meet a bunch of criteria, and once they reach those criteria, for safety purposes, we put them in a wheelchair, we take them down a private elevator that takes them down to the garage, indoor garage, where their family member or friend is waiting for them, and off they go home. So again, in the recovery room, another thing that's great is just the natural light in here. And you might not think it's important, but certainly I think patients recovering in this type of setting when there's nice natural light and a nice view certainly psychologically makes patients feel better and makes recovery that much more pleasant. So this is a sterilization room, and this is a dedicated room where instruments are sterilized. And we have a dedicated person who works with us full-time just to sterilize the instruments. And this big machine here is a sterilization machine. And by the use of steam, and really, really hot steam, it sterilizes the instruments that are first washed, then placed into these packs, put in the machine, and it takes about an hour and a half to sterilize a bunch of different sets. But because of the size, you could sterilize an entire day's load of cases with this sterilization machine. To the back end of the clinic, which is more the administration area. And once I've seen patients for consultation, I'll bring them over, for example, to one of the offices where the patient coordinator is, and they'll meet with her, and she would be their basically point of contact, any other questions that they might have. And if and when the patient decides to have surgery, they will go through her and she'll organize everything. And that's why you'll see things in the hallway like these breast implants, which are just in preparation for tomorrow's surgery.